From the Einstein Healthcare Network studios in Philadelphia, this is Health and Wellness.
Hello everyone, I'm Genaye Channel with my co-host, Dr. Anastasopoulu, an endocrinologist with Einstein Healthcare Network, and this is The Bone Show. Our topic is osteoporosis, so let's get right to the questions that stem from our viewers. First and foremost, what is osteoporosis?
So osteoporosis is a bone problem. It's usually the quality of the bone, the density of the bone that suffers and makes the bones thinner. It could be because we have some bone loss that can happen for a lot of reasons, or because we don't necessarily form as much bone. But the end point is that the bones become really more weak and they can break easily.
So Dr. Anastasopoulu actually brought a model here. This is the spine, correct?
Yes,
so if you can tell us, I guess, what happens to our bones as we have osteoporosis or as we're diagnosed.
There are different vertebrae. These are the bones we have on our back. And if you can tell the difference, this one here, the second, the third, maybe that one down here, they are the healthy bones. They are strong and quite really dense in the quality in there. But when we go to this one, you can see there are a lot bigger holes that, of course, they are going to make this bone much weaker, to the point that on the other two here, you'll see how those bones become smaller. Those are models of bones with fracture that could be symmetrical, that would be a compression fracture, and fractures that could be in a lot of disorganized way, and it would look like a wedge fracture.
How is osteoporosis diagnosed?
The best test, and maybe at this point, maybe the main one we are doing, it's called DEXA bone density or DEXA scan. That is a painless radiology test, meaning practically x-rays, but they are done with a special equipment, and it does show the different density of the bones we want to check. What doctors are asking for is the bone density of our spine, the hip, and a lot of times the wrist, that might be very small bones that can suffer damage with those bone loss earlier in life. But between these three sides, you can have very valuable information to evaluate the bone health of a patient.
So what are some preventative methods that people can take to prevent osteoporosis, or can they?
I'm glad you're asking that earlier in the show, because things can start much earlier in our life. Something that we can do is, for example, encourage our youth, starting with our own children, to be more active. Exercise helps for the formation of the bone.
Sure. Yeah.
So it can start much earlier than we sometimes believe. And of course, throughout our life, having very healthy lifestyle with good habits versus bad habits, and probably we can touch bases on that later, it will help the quality of the bone to get to the best point. Of course, in our lifetime, there are going to be a lot of different factors, from medical diseases to other bad things that we might be doing that can cause this bone loss. And when we talk about the different factors, hopefully try to prevent them from happening. That would help the whole quality of the bone overall.
Mm-hmm. So what is the difference between men and women when it comes to osteoporosis? Is there a significant difference?
Some difference, yes, because it seems women, they hit certain times in our lives, with the most well-known being menopause, that we lose the protection from the estrogen. And that's the time that we are losing more bone than expected for our age. Men are also going to have that bone loss. Age-related would be obviously the first factor. But throughout their lifetime, they can have diseases that can cause the bone loss. So the bottom line is that men can have their fair share of osteoporosis, but it is more common in women.
Are there any genetic factors when it comes to osteoporosis?
We always like to take family history when we evaluate a patient for osteoporosis, mainly because a lot of studies have shown that if you have a member of your immediate family, mother, father, that they suffer from osteoporosis, especially having fractures in their lifetime, that puts the patient on higher risk of developing osteoporosis and maybe having problems with their bones themselves.
What can people do with their diet to prevent osteoporosis?
Main things that we encourage patients to do would be take enough of calcium and vitamin D. I think that's the two most popular components of our diet that also help the bone health. So dairy products that are fully loaded with calcium, I think would be a great idea. So don't give up milk just because you become an adult. That would be maybe a good rule to follow. A lot of other dairy products will have enough of calcium. And then sometimes we forget it's not only the milk, it can be veggies, it can be really different nice salads. A lot of other products, but healthy diet could help a lot. For the vitamin D, the one thing I want to mention that I think you might have heard enough, but we don't always remember it, is that sunshine can help to create vitamin D under our skin. So it might not be just diet, but some healthy habits that we can follow and get the best out of it.
Definitely. Okay, so let's talk about treatment. What treatment options are available for people who have osteoporosis?
A lot of different medications. Apart from the supplements that we always consider them being something we would use, let's take it as a given, then there are oral medications, meaning pills, and the frequency of their use can be from a daily product to a weekly product to a yearly product. Actually, monthly product would be with the oral agents more. But also we have a lot of injectable medicines. So the latest years we have different options from a lot of different categories. And depending on what it fits the profile of the patient, meaning everybody might be needing something different from somebody else, the doctor would make that decision for their patient.
What are some signs that some patients should look out for when it comes to osteoporosis and if they may have it?
Osteoporosis is also known as one of the silent diseases because honestly, you don't have necessarily symptoms that you feel a pain and that will make you go to the doctor or make you think of the osteoporosis if you know a little bit about it. It doesn't really come or become obvious till patients have a complication, and that means they have a fracture.
What are some risk factors that affect bone health?
A lot of different things that sometimes we are not aware of can affect the quality of the bone throughout all of our life. To give some examples, smoking has been shown to cause a lot of bone loss. Same thing like alcohol, caffeine, and of course the things that might happen as medical diseases, and that might be beyond the scope of our discussion, but different medications that we are using for different diseases might also have a bone loss as one of the side effects. So every patient needs to be evaluated individually, and that's what the doctor would do to find out what might have affected their bone health, and then it might be a little bit easier to give instructions, make some suggestions, definitely recommendations, how patients can treat themselves and have stronger bones.
Well, thank you so much for sharing that great information.
Thank you.
Be sure to watch more episodes on this topic and other issues of interest to all patients here on The Bone Show. We will see you next time.